Hello, this is my video for the CVAD dressing change. Okay, so the first thing I'm going to do is I'm going to go ahead and gather my supplies, which is going to include the dressing kit change, 2 face masks. In this case, I'm already wearing one, and then one for my patient, and a measuring tape. And in this case, I don't have a measuring tape, so what I'm going to do is I'm going to bring with me a ruler. Okay, so now what I'm going to do is I'm going to go ahead and enter my patient's room, and I'm going to do my first 5. The next thing I'm going to do is I'm going to go ahead and assess my patient. So I want to make sure that he's able to participate. So in this case, I'm going to go ahead and move Mr. Elmo this way, and I'm going to adjust my camera so you can see him. Okay, I think that'll work. Okay. So what I want to assess for my patient is that he's able to tolerate the procedure. So I want to make sure that he is able to lie in a supine position for a long period of time, or as long as the procedure takes, and that he's okay with having his mouth covered during the procedure as well, because he is going to have to be wearing a mask. In this case, Mr. Elmo is doing really good. He's in a supine position. He's not desatting on us. Okay, and what I'm going to go ahead and do next is I'm going to go ahead and raise my bed to a comfortable position. And once that is in a comfortable position, I'm going to go ahead and prepare my work area. Okay, and this normally entails, just cleaning off your surface area, making sure that it's nice and clean and sterile for anything you're going to be putting on there. What I like to do is I like to go ahead and just clean the surface area twice. So I'm going to do it now, make sure that it's nice and clean. And I'm just going to go ahead and for temporarily just put my kit there and have everything ready. Okay, now what I'm going to do is I'm going to ask my patient to go ahead and turn away from the actual site that is right here. Okay, and I'm going to go ahead and put a mask on. So let me see here. Can you see his face? He has no ears, so we're going to pretend. There we go. So Mr. Elmo has a mask. And his head is basically turned to the side away from the area. And what I'm going to do is I'm going to go ahead and hand sanitize now. And I'm going to go ahead and don some clean gloves. Okay. Now that I have my clean gloves on, I'm going to go ahead and carefully remove the dressing. If the dressing has a bio patch, and what I'm going to be doing is I'm going to go ahead and remove some tape here because it was holding the tubing together. And I'm going to go ahead and peel off from the edges. Let me see here. Let me move this. You can see. Okay. I'm going to move it from the outer edges in, and I'm going to be really careful to avoid dislodging the actual catheter. So what I'm going to do is I'm going to go ahead and with one hand stabilize it, and then I'm going to go ahead and carefully remove the film. Okay. Oh, this is really stuck on there good. Okay. But all the while just making sure that catheter is stabilized. Okay, and once the tape has been removed, we are going to carefully just remove the whole thing. Okay, and what we're doing is we're going to be checking for coca. We're going to be checking for color, odor, consistency, and the amount. In this case, there's not a lot there. It is just natural in color, and it's just a small amount. There's no odor as well. Okay, and then I'm going to be assessing the area. So I'm going to be making sure that I'm going to be assessing for redness, swelling, any signs of infection or infiltration. In this case, everything looks really clean, really good. And what I'm going to be doing next is I'm going to be taking my handy dandy ruler here, and I'm going to be measuring the length of the wire, not the wire, I'm sorry, the catheter. Okay, and at this I show that it is about 9 centimeters long. Okay, and the 9 centimeters I'm going to be comparing to what is on the patient's chart to make sure that the actual catheter has not moved. Okay, at this time, I'm going to go ahead and discard my gloves, all the while encasing the old dressing in it. Okay, and I'm going to go ahead and perform hand hygiene, wash my hands nice and good. Okay, now I'm going to go ahead and do this one more time just because I like my area to be clean. Excuse me, Elmo. I'm going to go ahead and clean my area. It's all nice and clean. Let it dry. Okay, hand sanitize. All right, now we're going to go ahead and prepare a kit. So we're going to open our kit. And the first thing I see on here is my gloves. So for right now, I'm going to carefully grab my gloves, put them aside. Okay. Now what I'm going to be doing is I'm going to go ahead and prepare my station. Make sure everything is there. Okay, so I show here that I'm going to go ahead and open my chlorhexidine. Make sure that's nice and open where I need it. The alcohol cleaning tube. Make sure that's all set to go so you can push down on it, click it, make sure it's good to go. And then we have the bio patch. Go ahead and open it and blend it. There we go. Throw that aside. Okay. And then we have in here our gauze, and we are good to go. Everything is prepped. So now I'm going to step aside and I'm going to go ahead and don my gloves. Okay. So the first thing I'm going to do is I'm going to grab my glove aside from the area, put one on, grab the other one away from the area, and we are good to go. Okay, so now what I'm going to do is I want to keep that area as sterile as possible. Right now, just so you can see, I am going to go ahead and move Elmo back into my little area so you can see it just for video purposes, but I would not be doing this. My hands would be nice and sterile, okay? Okay, there we go. Okay, so my area is all together. And what I'm going to do is I want to make sure my hands are nice and sterile. I'm going to go ahead and grab a gauze. And I'm going to carefully grab the tube, just like that. Okay, and then I'm going to get the chlorhexidine. Okay, and I'm going to go ahead and clean around, starting from the closest part of the tube, and then I'm going to be working my way outward, making sure it's nice and clean. And how many chlorhexidines are in there, that's how many I'm going to use. Mine only came with one. Next, I'm going to grab the alcohol prep pad. And now what I'm going to do is I'm going to do the same thing. Make sure it's good to go. And I'm going to do it in the same motion. But then I'm also going to be cleaning the wire. Make sure the tubing catheter here is nice and clean. Once that's done, we're going to put it aside. And now it's time to put the bio patch on. And we're basically going to be doing this after the area is completely dry. Okay, so we have the biofilm here, the bio patch. Make sure it's open and the blue side is up. Okay, so we do that. It's nice and done. Okay, so now what I'm going to do, the last part we need to do is put the transparent patch on. So I'm going to go ahead and put that, throw that aside. Okay, now I can use both hands. And we're going to put the bio patch on. Okay, so we're going to carefully open this. Okay, and we're going to carefully secure it over the catheter, all the while making sure the catheter is nice and secure, which it is. Okay, and we're going to remove the taping on the outside, just like that. And then we're going to be dating the area with our initials, date, and time. Okay, so the tachyderm is in place, and then what we're going to do next is get a piece of tape and secure the catheter because we don't want it flopping all over the place. So it is nice and secure and it's ready to go. Okay, so now what we're gonna do is once everything is secure and it's labeled, I'm gonna go ahead and discard my gloves, hand sanitize, and I'm gonna go ahead and now do my final 4. I'm gonna go ahead and raise my patient back up to a comfortable position. I'm gonna go ahead and put him back, like in a semi-Fowler's position, making sure he's okay, everything's good, give him his call light. And then I'm gonna go ahead and discard all my items, make sure the area is nice and clean. And I'm gonna go ahead now and after doing my final form, I'm gonna go ahead and document according to hospital policy with all the findings. And that is my video for my CVAD dressing change. Thank you.